This is Dan Rea, the host of NightSide. I hope you enjoy listening to the NightSide podcasts here at the NightSide website, and I invite you to join us every Monday through Friday night from 8 to midnight live for NightSide on WBZ News Radio 1030. We haven't talked about the Affordable Care Act, or as we call it on this program, Obamacare, for some time, and I am delighted to welcome back to NightSide a guest that I had a couple of years ago, Dr. Elizabeth Lee Vliet. She is she's a preventive and climacteric. I haven't pronounced that correctly. I don't think
you did pronounce it correctly.
I did. Medicine. Well, what is it now that I've pronounced it?
It's hormone aging in men and women from puberty to menopause or andropause, and all the things that go along with that.
Well, she is a specialist with medical practices in both Tucson and Dallas, and she is also a director of the Association of American Physicians and Surgeons. She speaks as an independent physician, no financial ties to any healthcare system, pharmaceutical company, or health insurance plan, and her allegiance and advocacy is to and for patients. As a matter of fact, that I guess is the motto of your group, the Association of American Physicians and Surgeons.
It absolutely is. That's our focus.
All right. Well, we're going to be talking about the Affordable Care Act, or as we call it on this program, Obamacare, often in the weeks ahead. And on Monday, Tuesday, and Wednesday, if I'm not mistaken, the U.S. Supreme Court is going to be hearing arguments in the case, correct?
That's correct. It starts Monday morning.
Let's talk about where we are. The Affordable Care Act, as called, is now 2 years old, and it seems to be split on traditional party lines, if you will. Most Republicans are pretty skeptical of it. Most Democrats seem to be willing to embrace it. Is that a fair characterization, or have I painted with too broad a brush?
I think that's a little bit of a broad brush, Dan, because I don't think the split is totally along party lines. I think perhaps in Washington that's the case, but if you get out across the country, there are many people of independent, Republican, and Democrat who are just average citizens who are very much opposed to the government micromanaging their medical decisions, medical information, and telling them what they have to buy in the way of health insurance and who they have to see and what they can get. So I think that the public is far more aware of the massive assault on both medical freedom and religious liberty with this new legislation.
Let me for a moment just try to understand the position that you have, and you have been a critic of Obamacare from really day one, as I remember you from a couple of years ago. And I know it's a very complicated and confusing issue, and we deal with a lot of issues in this program. I can't think of one that is more complex. I think it was 2,300 pages in the original piece of legislation that was passed, which
I think 2,700 when they finally finished, and 4,000 pages of regulations written just for the first section alone.
Right, and of course we all remember Speaker Pelosi saying, "Well, we'll just have to pass it to find out what's in it." I don't think anyone read it. I don't think anyone really knew what was in it. For those in the audience, give us your synopsis, if you will, of what is wrong with this legislation, either philosophically or medically or both.
Well, philosophically, America was founded on the concept of individual liberty, fundamentally. This is the antithesis of that. This is government determining your decision-making as it relates to your health care, your medical decisions, treatment options, and access to care and specialists and so on. So it's really philosophically, it is the antithesis of the foundation of this country. Remember, the founders of this country were escaping big government. They were escaping a king telling them what to do and how to live their lives. So we were founded with the opposite of that, and we are now back to the philosophical underpinnings of Obamacare is the belief that the government should be making all of these decisions that they know better than we do, and that bureaucrats and those in power are the ones who should allocate our rights and tell us how to live our lives. So that's the philosophy. From a medical standpoint, I think one of the things that will make sense from a common sense standpoint, and it doesn't really matter what your political party is, if your life is at stake, it doesn't matter if you're a Democrat or Republican. If you need an MRI and you have to wait 6 months to get it and you're paralyzed by the time you get it, your body doesn't care what political party you belong to. You're still paralyzed.
So too much red tape, I guess, would be the quick synthesis of that argument.
Well, partly, but for example, in Canada, and I would encourage your listeners to go online and look for the documentary Sick and Sicker, which was done by a Canadian physician about the Canadian healthcare system, showing how President Obama, in his own words, wants to set up a similar system, and what the reality is. When the government allocates the resources, if they haven't allocated enough money to take care of having MRI centers or CAT scans or orthopedic surgery facilities or training orthopedic surgeons, and you have to wait in Canada 12 to 24 months for a hip replacement or a knee replacement or shoulder surgery or back surgery, then oftentimes by the time the patient gets diagnosed and gets to surgery, they have lost function that may never come back. Or they've lost so much muscle mass and bone that you can't regain it, and surgery doesn't go as well. In the United States, people are used to being able to make the decision with their physician when they need a surgical procedure and being able to get the MRI studies quickly to determine what's wrong and get the surgery quickly if that's what is needed. For example, I would be a quadriplegic if I had not been able to have an MRI quickly when I had a cervical herniated disc in my neck and needed surgery right away to prevent permanent spinal cord damage.
My guest is Dr. Elizabeth Lee Vliet. She is a physician. She practices in Tucson and Dallas. We've introduced her already. I'm going to reintroduce her after this break, and we're also going to continue to discuss why she sees Obamacare as a real threat to liberty, as well as to the provision of medical services. The number is 617-254-1030, 888-WBZ-1030. If you want to ask a specific question, I think Dr. Vliet is probably well positioned to answer whatever questions you want. If you want to disagree with her, as long as you do it politely, that's what this show is all about. Reasonable people can disagree. This will be argued next week, giving you a little bit of a preview of what the news will be talking about next week on NightSide. Dan Rea coming right back.
But we have to pass the bill so that you can find out what is in it.
Dan Rea, the voice of reason. 617-254-1030 or 888-929-1030. WBZ News Radio 1030.
My guest is Dr. Elizabeth Lee Vliet. She is a doctor, preventive and climacteric medicine specialist with medical practices in Tucson and Dallas. More importantly, for the purpose of this program, she is appearing as a director of the Association of American Physicians and Surgeons. She is a doctor who firmly believes that Obamacare is the wrong way to go. Dr. Vliet, let me just play devil's advocate for a moment. I read an interesting piece by Jeff Toobin in New Yorker magazine of a day ago. I'm not sure when it was published. Would you agree with me that the key provision in here is and this whole case is probably going to rise or fall on the so-called mandate, whereby if the funding mechanism for Obamacare is a mandate that people have to buy health insurance if Obamacare is upheld?
So your question is that the core?
Yeah, is that the key element? It was from a legal point of view. I think what the court is going to decide in this case, it seems to me that a lot of the issues in terms of whether or not MRIs will be available on time, whether or not you'll be able to consult with the doctors of your choice. I think that's going to be sort of left to the actual imposition of the program if it is indeed upheld. I mean, the key to this, I think, is the funding mechanism. And the funding mechanism is the individual mandate. Even
if the court decides to eliminate the individual mandate, there are still many elements of the legislation that was the health care legislation that was put into the TARP or stimulus bill in February 2009 that still controls people's medical records, putting them in the hands of the government, and also sets up the entire government bureaucracy for comparative effectiveness research training and the training and the implementation of that panel, which then decides what treatment people will be allowed to have based on their age and their quality of life years left and the cost. So, yes, it's correct that the individual mandate requiring every person in the United States, whether they want to or not, by virtue of being alive and breathing, being required to buy government-mandated health insurance. That is one of the fundamental constitutional issues that is before the court. Another large constitutional...
Let me just, if I can, I just want to struggle with that just for a moment, okay? So if we can agree that that's an important issue, and if the court were to strike down the individual mandate, that would be, in my opinion, a death blow to this act. Now, you're arguing, or you're telling me, though, that there would be other provisions that would survive. Let me focus, if I can, on the individual mandate, because I know that a lot of people are arguing that not by the Obama administration is arguing that the Commerce Clause comes into play here because medical care is something that everyone's going to be involved in. One of the constitutional arguments is not buying a product is not, by definition, commercial activity. Here's my question, and this is one that I struggle with a little bit, and I'm hoping you can help me grasp the issue. The issue that Jeff Toobin was making in New Yorker magazine was, whether we like it or not, everyone is going to, at some point in their life, need medical care. And if we do not buy health insurance, or if we do not have health insurance through our employer, through our spouse's employer, through the government, if we're on Medicare or something like that, if we are out there naked to the world without health insurance, and we do have that medical crisis or that medical problem, then the rest of society will be obligated to pick up the tab for those who are not smart enough, perceptive enough, generous enough, willing to purchase their own health insurance. And it almost sounds to me like Toobin is making sort of a individual responsibility argument that because there will be some people out there who will defy common sense and try to get through life without health insurance, when a problem befalls them, you and I are going to pay for it. And that's one of his underlying justifications for mandating everyone have health insurance.
Well, it sounds like he totally doesn't understand that has been the case in the United States since 1986. The fallback position has been passed by the federal government since 1986 that no hospital in this country could turn someone away because they didn't have health insurance. So the taxpayers have been paying for those without insurance all along.
Right, but I think what he's saying is that one of the benefits of the Affordable Care Act, or Obamacare, is that if people who are irresponsible and who don't have health insurance. I mean, I'm sure, for example, that you have life insurance, you have home insurance on your homes. A rational person will have insurance, but there are people out there, and I'm told that even here in Massachusetts, there are people who still do not have health insurance, and they show up at the emergency room. We all pay for it.
That's true. And at the state level, each state can determine under the Constitution, each state is the area where that decision and that mechanism should be put into place to decide how it's going to be managed to serve the needs of that state. That's the way the country was founded, and that is the basis upon which we are supposed to be operated as a republic.
So let's
assume not going to be feasible to have everyone be able to get the level of health care they think they need and deserve and are entitled to, and have the taxpayers pay for all of that. CBO has just come out with an estimate that it's costing double over the next 10 years what they originally estimated in 2010.
So let's assume Obamacare is struck down by the Supreme Court, and let's assume individual states say, hey, you know what, we're not going to mandate hospitals in our state have to provide medical service. I think some people would say, wait a sec, so you mean if somebody gets badly injured, and they don't have health insurance and they go to a hospital, they're going to be turned away?
Well, that's not possible because the states do not at this time have that power. That power was already taken away by the federal government in 1986. So it's federal law.
So, but it comes back to then that essentially I can go through life without health insurance, and when I need medical care, everybody else is going to pick up the tab for me.
No. What you could do, the responsible thing to do would be to put money in a savings account and pay for your medical care when you need it, which is less costly for many people than paying the monthly premiums when they're not sick. So there are many free market ways, Dan, that we could solve the problem without having the government dictate the lives of every American and have every American, 100% of Americans, dependent upon the government to determine whether they're going to get the health care they need when they need it or not. We are a country that's been based upon individual liberty to make that decision ourselves and to decide ourselves how we're going to put aside the money to pay for it.
All right, my guest is Dr. Elizabeth Lee Vliet, and we're going to take a quick break. We have phone calls waiting. Susan in Chicago will start on the other side. If you'd like to join us, as soon as some of the calls start to drop off, we can get you in as well. 617-254-1030, 888-WBZ-1030, NightSide with Dan Rea and Dr. Elizabeth Lee Vliet, talking about the arguments, some of the arguments that will likely be made in front of the High Court next Monday, Tuesday, and Wednesday.
NightSide with Dan Rea. The News Watch never stops. WBZ News Radio 1030.
My guest is Dr. Elizabeth Lee Vliet. She's been a guest before a couple of years ago. She is a director of the Association of American Physicians and Surgeons, and she knows these issues inside and out. We're going to, if you have a question, you'd like to challenge her, you'd like to agree with her, everything is open. Let's start it off with Susan is in Chicago. Susan, how are you tonight?
Oh, I'm fine, thank you. But I was a little shocked. I picked up my suburban Chicago newspaper today. Big layoff at my local community hospital. They are concerned about Medicare in October. About half their patients are Medicare patients. The hospital will be rewarded or punished based on how long patients stay and whether or not they're readmitted within 30 days after being, told to go home. Is this compassionate? Is money everything here, or cost?
Susan, it sounds to me like they need a community organizer. You know?
Can't do everything.
Well, maybe after November, there'll be a community organizer to help them out. Let's get Dr. Vliet's reaction to that.
Well, Susan raises a very good point. This is one of the very serious issues. You know, some of the ads in the last campaign cycle were accusing the Republicans of throwing grandma off a cliff and cutting Medicare. That's flat out not true. When the Affordable Care Act was passed in March 2010 with 100% Democrat votes and 0 Republican votes, the Democrats were voting to cut $523 billion from the Medicare budget to shift money into younger people's care through Medicaid. And this issue that you're raising about your local hospital in suburban Chicago area is exactly what has been forecast by Richard Foster, the Medicare chief actuary, who said in 2009 that under the proposed legislation at the time proposed, that 40 to 50% of hospitals would go out of business. 40 to 50% of hospitals in the United States would have to go out of business because the cutbacks to Medicare would be so severe that they could not keep their doors open.
Where's that Medicare money going to go? I mean,
Medicaid for younger people.
Yeah.
and away from care for the elderly.
And we do have, I think we know that we have a burgeoning older population. Baby boomers like me, we're going to need that care as we get older. But I'm wondering if it's going to be there, Susan. What do you think?
Well, I think it won't.
Dr.
Well, I
Vliet?
think the data would agree with Susan on that. And the other thing is, remember that Ezekiel Emanuel, Dr. Emanuel, who is Rahm Emanuel's brother, wrote the article, Complete Live System, in which he stated clearly that we should concentrate medical resources for those between age 15 and age 40. And above age 40, medical care should be attenuated, or the correct word is rationing, and decrease the care for older people because they've already lived their lives.
Well, as someone who has recently passed 40, that bothers me.
Well, it should. There are a lot of us past 40.
I didn't recently pass 40, but I'd like to think I did. Susan, great calls, great question as always. Thanks so much.
And thanks for bringing that information to Dan's audience, Susan.
I'm going to be talking to my congressman this weekend at a town meeting. I'm going to bring it to his attention, too.
Well, let me give you a website for some more information. Please go to www.aapsonline.org, and there you will find some of the articles that explain some of these issues and a link to a number of videos and interviews that give you further information.
Give us that website one more time, Dr. Vliet.
www.aapsonline.org.
And what does AATS stand for?
The Association of American Physicians and Surgeons, the voice of independent medicine, whose motto is all for the patient.
Okay, so you're saying AAP is in physician. I thought you were saying T. So
Sorry.
AAP is in physician and then surgeon. So AAP for physician and S for surgeons, online.org. Thanks, Susan.
Thank you.
Thanks very much. I'm sorry, it was sounding into my older ears a T, and I wanted to make sure we get people to the right place.
No, I'm glad you clarified.
617-254-1030 if you'd like to jump on board. Let me get Sammy from Pennsylvania real quickly. Sammy, it's been a while since we've chatted. How are you, my friend?
Yeah, when are you going to have Attorney Rominger on again?
He was. We had him on, a month and a half ago on the Sandusky case, right?
You won't let me on his local program here.
Well, I'm going to tell him that to let Sammy on. I can't imagine why, Sammy. Go right ahead.
All right. Hey, listen, one thing I'd like you to clarify if you can tonight. What's the difference between the Obamacare and the Romney care? That's number one.
I'll give you my answer, and then...
No, let me answer the second one.
Well, let's try them one at a time, Sammy. I want to get Dr. Vliet to answer that.
We haven't talked for a while, so give me some time.
I'm not going to cut you off, Sammy. Hold on. Don't worry, okay? I don't think there's much difference philosophically between Romney care and Obamacare. I think that Romney's attitude was each state should be sort of a little petri dish to come up with a program, and I think that arguably Obamacare was patent off of Romney care in many, many respects. And ironically, Romney care was in many ways the brainchild of friends of mine at the Heritage Foundation. Dr. Vliet, you feel free to disagree with me.
No, I think you're absolutely right. Romney care and Obamacare both cost too much, raised the cost for the patients when they said they were going to lower it, and increase the wait time to medical care. And Romney care was used as the model for Obamacare. And it's not working at the state level. It's even less likely to work across all 50 states for 330 million American people who have very different health care needs.
Go ahead, Sammy. You had a second question.
And the second question is, if we ever really want to bring these costs down, we need to look at medical training. Why does someone have to go to school for 10 years? Who determined that particular number?
That's a great question.
Let me finish. And I think a lot of students could become a doctor in 5 years or less.
Sammy, I agree with you. Let's get Dr. Vliet's response to that. That is a good question. I think that one of the things that I'm concerned about is that the AMA, I believe, has influenced politically the number of medical schools that are allowed to open in the United States. There are a lot of American kids who go offshore to get their medical degrees, and I think that there are more kids. I know a young man right now who graduated from Harvard with my son, and he is anxiously awaiting admissions to various medical schools. This kid will be a great doctor. He should have been accepted weeks ago. Dr. Vliet, again, am I on point or off point?
Well, I think both of you have a valid point to a limited part of the picture. But remember, we do have many other levels of health professionals who have shorter training periods of time. Physician assistants are a 2-year program. Nurse practitioners have a nursing degree and then a master's level, which is far shorter than a physician's education. So we do have different levels of training and duration for health professionals. That's not what's driving the cost up. What's driving the cost up is people have no idea what things cost. They're spending somebody else's money, whether it's the insurance company or the taxpayers or the government. They're spending somebody else's money. When you put money control in the hands of the patients, as has been done in the state of Indiana with the state employees program, as has been done by Safeway and Whole Foods, what you find is that people making their own decisions about how to spend their money are better consumers of healthcare services and drive the cost down in their communities. A good example is LASIK eye surgery. It's open market, it's free market. People compete on price, and the price has come down dramatically.
All right, Sammy, I got to let you go. Thanks very much.
And actually, Dan, when you bring the third parties into it, whether it's private insurance or government insurance, doesn't really matter. You drive the cost up with all of the middle management people.
All right, thanks, Sammy. I appreciate the call. Have a great night. We'll be back with more calls and more conversation for Dr. Elizabeth Lee Vliet, 617-254-1030, 888-WBZ-1030. Good questions so far. Keep them coming. Back after this.
News updates all day. Dan Rea and NightSide at night. But News Watch never stops. WBZ News Radio 1030.
Back to the phones we go, talking about the Affordable Care Act. We'll try to get as many folks in as we can for Dr. Elizabeth Lee Vliet. Betty in Bedford. Hi, Betty. How are you?
I'm fine, Dan. I just want to tell you, I went to Dr. Cohn and had a very good interview, a second opinion, and I have surgery May 10th. And I just want to say, Dr. Elizabeth, you're doing a wonderful job. And I agree with you, being a nurse for 30-some-odd years, the profession has changed so dramatically.
Dr. Cohn, who Betty refers to, is a friend of mine who's a heart surgeon at Brigham and Women's Hospital.
Right.
I see.
Comes
he
on
found
the program.
An aneurysm, Dan.
Yeah. Okay. And is he going to do the work?
Yes, he is.
Well, you're
our
in the
prayers
hands.
are with you.
You're in the hands of the best, Betty. You're in the hands of the best. You know.
I know. He told me that, and I give you congratulations again. Now, I have a question for Dr. Elizabeth. My daughter with the rheumatoid arthritis is only 34 years old. She now is found to have brain tumor, and she has been refused. She has Mass Health and to see an arthritic specialist. And I want to know how to get around this. Is there any way that I can overstep the boundaries and ask him if he could see her, if I paid or did something to help
Betty,
my daughter?
Betty, you know what? I can't give you that answer. I will say this. Why don't you raise those issues with Dr. Cohn? And I would, knowing Dr. Cohn, he'll do whatever he possibly can.
He would know, though, Dan.
Yeah, he would know, and he would give you an answer. And, of course, you know, we worked, you and I, to help your your daughter through Senator Brown's office before, so you can always call me as well, okay?
Okay, thank you very much, and God bless you, Dan.
Thanks,
Well,
Betty.
and very best wishes for successful surgery.
Thanks.
Okay,
Our thoughts are with you. Thanks, Betty. Keep us posted. Bye-bye.
Dan,
yes, go ahead.
I'd like to bring up something that maybe your listeners may not know about yet, that I think is really important. First of all, there's been a lot of focus on the individual mandate. And then there's the whole issue of severability. But one of the things that is not being discussed is the way in which the new legislation, the healthcare law, violates the Fifth Amendment. And let me point out something for your listeners to be thinking about and discuss with their representatives in Congress if they're concerned about it. Secretary Sebelius ruled in October 2011 that all private medical insurance companies must send all of their patient data to Washington's central database with the federal government without the patient's further permission. And if you read the Fifth Amendment of the U.S. Constitution, that is a direct violation because it is taking the patient's personal medical data, the patient's personal property, without due process at law, because they're not getting the patient's further consent before taking the information from the private insurance company and putting it with the federal government. And then the federal government is using it as a data mining way to determine healthcare allocation in the collective good. So the individual person is having their private property taken by the government without due process and used for the collective good without just compensation, directly violating the words of the Fifth Amendment. And most people don't know that their personal medical data has been ruled by Secretary Sebelius to now belong to the federal government.
I was totally unaware of that myself, Dr. Vliet.
It's staggering.
Yeah, if you could send me or just refer me to something on that, I'd love to be able to talk more about that on the program some night, maybe when you're not here. But that is stunning. I was not aware of that.
Well, I would encourage you, look at the October ruling. There was an article in the Wall Street Journal about it. There have been lots of articles in some of the medical journals.
Fair enough. I'll get to that, I promise. Want to get to these other callers for you.
Certainly.
Bill is in Braintree. Bill, how are you tonight?
Hi, Dan. How you doing?
I'm doing great. We're getting a little tight on time here on Dr. Elizabeth Lee Vliet.
Absolutely. I agreed with that whole what you had said earlier regarding people not having to pay regarding the mandate. Why should I have to pay for people to go to an emergency room? And I was wondering how the federal government went ahead, or the courts went ahead, and what the ruling was to say that it was okay for all hospitals, that hospitals had to treat.
Yeah, that was a law, I believe, passed by Congress. Am I right?
Yes, 1986.
It was passed by Congress and signed by Ronald Reagan.
And it was held up in the courts that it was legal?
Yeah.
So that mean that then would it also mean then if
well, there's a lot of hospitals, Bill, there's a lot of hospitals in the southwest portion of this country, California, Arizona, and Dr. Vliet practices in Tucson that, as I understand it, have closed because of the amount of people who were using emergency rooms, and the hospitals just basically went out of business. Am I right or wrong on that, Dr. Vliet?
Yes, absolutely. We lost all but one trauma center in Tucson, largely because of the uncompensated care. Texas is struggling under the burden of uncompensated care under this 1986 law.
The federal government was able to basically pass a law saying that all hospitals needed to treat people.
Yeah.
I know, but I can't see why they couldn't pass also saying that the mandate basically would be able to use for everyone.
Well, that's what Obamacare is all about, Bill.
Right.
I think you've identified at least a good portion of what it's about. Bill, I'm going to run. I got to get some other calls in. Okay. Thank you. Let me go to JJ in New York. JJ, you're on with Dr. Elizabeth Lee Vliet.
Hi, guys.
Hi. How are you, JJ?
Good. I'm calling from New York. The Obamacare thing, it's very complex, but, basically, it seems like the good parts of it is that They're trying to find a way for everybody to be covered, and they want to take away the ability of the health insurance to deny coverage for pre-existing conditions. And about 30 years ago, we didn't really have such a profit motive in our health care. And when you think about struggling families that are just trying to take care of their sick kids, it's pretty weird, don't you think, that we go through a for-profit middleman, and about 30% of the cost that we pay just goes to line the pockets of these companies in Hartford, and that this entire industry was built up.
Well, let's get Dr. Vliet's reaction to that, JJ. I have so many answers going through my head. I'm going to let Dr. Vliet take it. Go ahead, Dr. Vliet.
Well, part of the problem is the middleman. And it doesn't matter, as I said earlier, whether it's government middleman or private insurance middleman. And what our goal is to get back to the basics of catastrophic insurance for major cost, and having people then be able to have health savings accounts that would give them a pot of money that the individual patients decide how to use. That's the way it used to be. It's much less expensive. Medicare already costs 34% more than private insurance companies that provide the same coverage. So we're looking at massive extra cost. And if you look at struggling families, President Obama promised that families would pay $2,500 less in insurance under his plan, and what we're finding is, before his first term is up, that families are paying $2,500 more per family than what they would have paid without these new regulations that started going into effect in the fall of 2010.
JJ, hate to do this to you, but we're flat out of time. I wish you'd called earlier, okay?
You're right. You're right about the catastrophic, though, and the healthcare companies are banding together to prevent us from getting that.
There could have been a lot of things Congress could have done individually. Could have increased the portability of insurance, or all sorts of issues. JJ, unfortunately, I'm up on the 11 o'clock news. Thanks. Dr. Elizabeth Vliet, if you'd stay there, I'd like to thank you off air, but I want to thank you on air. People can go to your website, which is AAT, as in Thomas, S, online.org.
No, AAP as in physician.
Well, I corrected myself before, and I had written it down incorrectly. AAP, thank you.
You're welcome. And my website is herplace.com for more articles as well.
Okay, your webpage is what? Your website?
www.herplace.com.
That's even easier. I like that. Herplace.com. Stay there. We'll be back with the 11 o'clock hour right after Don Huff and the 11 o'clock news. 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 And the 11